We're starting at 7. I'm just in class already. And this is just a Q&A class. We're still doing medical terminology. Got a speaker over here on the floor. Speaker, microphone. So, again, this is a Q&A. And this is your class from yesterday. So I got in kind of late last night from work, and I didn't get a chance to do your class last night. So we're doing class now. If you guys got any questions, let me know. You should be in medical insurance billing, okay, and medical terminology. So some of you guys are doing 2 courses, which that's cool. Do 2 courses to kind of get you through. And for some of you, this is really like a brush up for you. So we're going over 9, 10, and 11 in medical terminology. Hopefully you guys have your books. And again, this is just like the little chatting part that I'm doing right now. It's not quite 7 o'clock in case somebody wants to come in and ask a question. Okay. So the Sapphire classes, okay, for medical terminology is the playlist that says medical terminology. So if you want to kind of go in there and look at medical terminology classes, I think we're on class 6, right, guys? Class 6. The previous classes are in that playlist. For the medical billing classes, medical billing class that we did, you guys can archive that. It's in the medical billing and coding virtual class, okay? It's in that playlist. The coding playlist I have not made yet because we're not in that class as of yet, okay? So one of your subjects tonight is the nervous system, cardiology, and we are just finishing the male system because we were doing that Friday, okay? Your next class is going to be Monday. I have changed the hour to 7 because I seem to be getting home a little later than normal. So class will be at 7 o'clock. Some of you are asking me about the books. Look below and you will find the link for the books. Okay. The Sapphire link is there. The Sapphire course bookstore is there. The Amazon links are also there. When you go to Amazon and get that new book, just either type in my name or type in Sapphire Physician Code, and that's fine. Let me know how you guys are doing. I love the emails. Everything that you guys send me in the email, I try to answer it here because somebody else might have the same question. Okay. So I'm in early. We only have about 3 minutes till class actually starts. So even when you guys do your archive, just make sure that you're taking notes while you are listening to the archive. If you have a question and I'm not on the discussion board, just you can DM me, that's fine. Most of the time I'm on Twitter. Twitter is like my political stage. And, I kind of talk to a lot of people on Twitter. So a lot of times I'm on Twitter. You guys just see me on Twitter as Lisa Real Talk. Okay, there's a dash in between that Real Talk. And we kind of talk about a lot of different things that has to do with the government. I do put stuff up there in regards to the class. So hopefully they're also archiving too. But I do see a lot of you in there archiving the chat. That's cool. Now, for the medical terminology, some of you who might have just started the class, let's throw up the link real quick. This is the link that you're going to get your books from. Okay. This is the link you're going to get your books from. Okay. Let's remove that. Let's drop this up. This is the classes, okay? There's 3 different programs. There's an advanced, transitional, and a basic, okay? You guys can archive that and take a look at that. right now. I'm just kind of moving through slides just to kind of put up a few things here for some of you who have not seen this before. So we've already passed these, but I'm just kind of putting this up here because it has how long the medical terminology class actually is. So it's 21 classes, okay? We're up to the 6th class. It's 3 days a week, okay? It's 2 hours a day. So that includes your homework, okay? Your homework is your practice, okay? And yeah, I'm expecting you to do an extra hour, okay? So you have your theory and you have your practice, okay? Those of you who are asking me for tests, don't forget that book is out. Okay, that book is out. I think I took it down, but the book is out. And y'all know I'm gonna put it back up, but it's out. Okay. That book also has, yeah, it looked like I took everything down. Oh my gosh. So that book also has questions in it. It also has answers in that book. Okay. So some of you who have been asking for tests, make sure you look at that book. Okay, because there are exercise tests in there. Remember when I said, let me see if I can get all this in here. I sure can. Remember when I said I'm gonna put tests also in medical terminology. So not medical terminology already has it. The medical billing book. So this one, remember, this is the series on 1, and then this book, it only has medical terminology, medical billing in here. Let me show you the other one. I know I get twisted with which book is which. Let's go in and share our screen. Okay, so let's go ahead and drop that down. So some of you who do want tests, go to Amazon.com and drop in Lisa Lambert or drop in Sapphire Physician Coding Series 1 or Series 2. Okay. So this book, you see this one, that's medical terminology. Okay. Medical billing. Okay. And coding in this book. Why, Ms. Lambert? Because this book is actually showing you, okay, how to do medical billing, or it's not showing you how to do it. It's actually introducing you to medical billing and coding. Okay. So if you're new to medical billing and coding, that's your book. Okay. This one is your medical billing. There's no tests in here. I think I have human resources stuff in here for you guys. This one is a pretty big book. It has both. It has quiz, tests, HR stuff. It has a lot of stuff in this book. Okay. So go to Amazon and get this book. Okay. It's also going to help you with medical terminology. Okay. So let's make sure you don't sleep on that. Let me see if my Elsevier is still up. Okay, so it is. So again, let me just show you what book we're in before I continue on. So I'm just going to go to the cover page real quick. So you guys know I'm in language of medicine, and this book comes in different versions. Okay. It doesn't really matter which version you get. If you want to get the new one, you can get the new one. I'm fine with that. If you want to get the old one, get the old one. Nothing is going to change. Okay. So I'm just changing screens right now so we can put this up here for you. If you have your book already, excellent. If you have your book already, you should be able to follow me. Do not forget, you can still do the Kindle and look at those first few pages. So don't forget, today is our marathon reading, and it is to start your CPT, HCPCS, and your ICD-10, okay? And this is just to kind of get you started before we even get to that point. Okay, so that's what that's for. Okay, you can go into your Amazon and go into your Kindle and download these books. All right, there's no fee. All right, if you have Kindle already, just download these books and you should be able to look at like the first 1,000 pages or something like that. Those of you who were with me on Friday night, we got as far as musculoskeletal system. I was hoping we would get a little longer, at least to OBGYN or, maternity, so I could show y'all some of those codes in there. But because I wanted y'all to look at it too. But since we only got up to musculoskeletal system, we'll do more in musculoskeletal system or in integumentary. So I haven't decided which one we're going to do. Those are kind of hard for you to start with fresh. Maternity is a little bit easier. But you guys send me a message and let me know if you're able to get into the Kindle. We can start with musculoskeletal system if you want to, but I would prefer to start with maternity. So again, if you don't have your books, follow along because I'm pretty much backtracking. You guys know how I do. Let me see what's in here just to kind of backtrack. That's one of your schedules right there. So, you guys have seen that already, but you guys know when I come on, I kind of backtrack to kind of show you a couple of things. And what's in the classroom, Sapphire Academy. Y'all know we have 3 programs. And again, this is, your medical terminology Q&A. And in this Q&A, we just ask whatever you want to ask. You have any questions, just, let me know. So 9 was male reproductive system. And I don't know why, but I got a lot of emails from y'all. Miss Lambert, there's no reproductive system. Yes, it is. Males have reproductive system. And y'all sent me all those emails. Did y'all look at the last chat that we went over? Okay, so that's why I definitely put this one back in here. And on that 7 and 8, we went over 7 and 8, and we always go over kind of 7 and 8, but it was supposed to be 9 and 8, so I'll put it on here. Okay. So in male reproductive system, there was exercises in here for you to do, and we did get up to that part. It's just some things in here that I can't really talk about on the YouTube. But again, right here, you guys have a lot of tests also in here that have words that you've seen before. Okay, that you are able to do. I just cannot show you those pictures that are in there in regards to that. But, it's still the same. Okay, I want you to do all of the exercises that you come across in chapter 9. The male does have a reproductive system. That it's a two-way street. It's not just the women. Okay. We talked about hormones. We talked about cells. Male external organs, reproduction, procedures that remove abilities to produce reproductive cells. I'm trying to get to, we're still on 9. I'm just kind of backtracking on 9 because I'm trying to see what we didn't go over. And again, if you guys do get the ebook, I think the ebook is amazing. All you have to do is click down and the answers are right there. You just pick it. Let me show you what this looks like. I love how this thing is because I am not gonna lie. I was one of those. I used to hate. Let me show you how this works. I used to hate ebooks. See, and you just pick. I did not like ebooks because I just couldn't get used to the picking and you had to use your mouse and everything. But now I'm kind of used to the mouse and clicking and keeping it moving. So you guys kind of get used to that. Okay. So again, we're on 9, and do not forget, chapter 9, you do need to do a summary on that. This is with Sapphire. Okay. Sapphire, do your summary. You don't have to submit it to me if you don't want to. Okay. But if you want me to see that summary, I think you need to send it to me through an email. Okay. And I don't know what happened. You guys are mostly sending me emails, and I know y'all are dipping into the class because I can see who's coming in and out of the classroom. I'm talking about the Sapphire portal, not YTU. I can see when you guys come dipping in and out too. But in the Sapphire portal, I can see when y'all come in and I can see when y'all left. Okay, so if you come in at 10:10 and you going at 10:15, I can tell. Okay, but when you go in there, drop your stuff in your file. Drop it in your file. Okay, so YTU, you don't have that, but you still can do a summary. Okay, and I want you to do a summary on the male reproduction. The summary is going to be based on what's in your outline in your summary. So go back to your chat and you will see what I want in the summary. Okay. And this is to help you. Okay. This is to help you to retain what you're reading. Okay. Now, how I want the summary is actually in one of those, I think it's 13, and that's in medical billing. So we went to the medical billing chapter 13, but I'm gonna throw it up right here. What I'm showing you is how I want the summary. Okay, and we went over this a few times, and you guys can look in this in the chat. Sapphire, you guys got this, have this in the Sapphire portal. We just want to kind of see if we can get this in on this chat. And here we go. And it's primarily about what I would be looking for in the summary. So for the male genitals, male reproductive system, you don't have to be totally invasive. Just and it's even for yourself. When you're looking at something and you trying to retain and you start spitting out, it's like rapping. You start spitting out rapping and you go, that's it. You got it. When you do your summary, you will feel the same way. That's it. I got it. Okay. This is the summary. So this is for YTU. This is also for Sapphire. Some students who are just admiring Sapphire and may want to come into Sapphire. Feel free, do YTU. You can go on Sapphire coding.myshopify.com and buy whatever course that you want. You still will have access. Okay, those courses will help you with YouTube. Okay, with your YTU. YTU is YTU University. This is YTU University Sapphire Physician Coding. Okay, so with the collaboration of YouTube, I'm able to give you guys more than some of the chats that I've been giving you. So that's why I decided to do my course on YouTube. Now, you still need to purchase courses with this class, but if you don't, that's fine. You still can learn from this class. Tell your friends, make sure y'all subscribe to this channel. Make sure y'all hit a like button. I'm gonna try to give y'all more of this, but right now, this is your summary. Okay, this is what I look for from my Sapphire students. Okay, they physically have to submit to me a summary of what they just read. So if they're reading the male reproductive system, I'm expecting at least 2 paragraphs of what they read, what they understood. Tell me about XYZ. So this page, this lets them know what I am looking for. This tells them, make sure there's a heading on the page. Make sure the chapter is on the page. Make sure your name is on this page. I mean, you have to do it just like you're in regular school. You send me something that you copy and paste it. You're not robbing me. You're robbing yourself because that's not going to work. So that's the reason why I want you to make sure you pay attention. Do the summary. If you do a summary on something, let's say we're having a conversation right now, and I need you to tell me what we just talked about 5 minutes. That's like a summary. Okay, so don't cheat yourself. Make sure you do the summary, and the summary makes you feel so much better. If you learn something, right? This is a good example. If you learn something, I'll take this down. If you learn something, right? Let's say you're studying and you're trying to train yourself to do something, and it's in your mind, but you still like, I ain't got it. I ain't got it. I might not pass. I ain't got it. When you write the summary down, you look at the summary and you go, maybe I do got it. Because that's what's in your mind. You already retained it. If you start writing a summary and you don't know what's that? I don't know. I can't remember. Then you need to go back. So if you're doing a summary on male reproductive system and you can't put nothing on paper, you gotta go back. Okay, so that's what that means. That's just like you have an experience in what you're learning, or you have an experience in going to an interview. So that is the reason why I asked for the summary. I'm gonna drop the summary up because I need y'all to make sure y'all do the summary. There's a purpose for me telling y'all to do the summary, okay? Make sure you do the summary, okay? Because it's just like if you go to interview and you kind of memorizing or retaining some of what's in your resume, and then I don't want the resume in front of you. If I start asking you to tell me about your resume, you shouldn't have to look at your resume because what you're telling me should be fact, right? So if I'm asking you as a prospect or potential employee of mine, and you can't tell me, then it's a problem. So that's just how it is. I'm going to say, well, what happened? So that's why I want you to do the summary. So YTU, after every chapter, do a summary because it will help you to remember. Okay. So again, castration, semen analysis, circumcision, these are not invasive words that I can't say, but I just want you guys to make sure that you go over this. And you guys remember those abbreviations? Make sure you do them. And again, if you don't have your book, don't worry about it. Just go to Kindle and get it from there, okay? They have several prefixes in here that you need. One, stomy, semi, cele, pexi, genesis, plasia. I must not be tired today. Y'all know I be stumbling over words all the time. Prostate, orco, terat, hydrid, pen. Y'all know what that is. PEN. If I say PEN, y'all know what the rest of that is. Okay. Prostate cancer. I want y'all to look into that because it may be on your CPC. Okay. So this is where I am right now, and I'm just going to switch over. But again, I'm just showing that again, just to let y'all know how important it is to make a summary. Doing a summary helps you to retain information. So that is the reason why I always say, do your summary. Okay. So that summary that you guys just took a look at, that's a summary that's inside the Sapphire portal that my students can go get anytime they want to. If they're doing work at home, and I don't micromanage, y'all already know that, they can go into that portal and find whatever they need. I'll show y'all the portal again at the end of this session right here. So this is a good one. Let me see if anything in there I ain't got nobody saying. Yeah, it's a whole bunch of stuff. When Fred was a newborn infant. Yeah, okay. So I can't say all that, but I want y'all to do that. Okay? I want y'all to do that. Oh, this is a good one right here. Because I seen this on the test. And, the girls don't even have to tell me. I already seen that on the test already. And not all tests are going to be the same. You're going to have different tests. When you take your CPC, yes, there'll be different things on there. But I just kind of want to give you a heads up on some of the things that you see in this book. Like I said, mine has a drop down. If you have a hard copy, that's fine. Just make sure you get these words. Now, all of these words, I love it. All these words, make sure you get them out. And then and words, they're medical terminology, okay? It's medical language. These are in the pronunciation terms, okay? It says the meaning for all the terms are in the mini dictionary. They're talking about in the back of the book, okay, y'all? And here's a site right here on elsevier.com. So I guess she has a separate type of dictionary. Hold on, let me put this in here because I don't know if you guys can see this, but if you're on your phone, just make this bigger when you're looking at it. See this link right here? That's a language of medicine dictionary. I think the author has done, so that's why they put that there. So I want y'all to see that too. Okay, so we're not going to spend too much time on mail. I just wanted to make sure that we touch bases on that. Let me just drop this real quick and see what else is in here. So again, we're in language of medicine. We are on pronunciation of terms, and that's the last chapter in the book. Now I'm looking at the review sheet with the glossary words. So yes, I want you guys to also look at that. So again, when you are studying for any test, you need to figure out a way to retain your information. The way I show you on this YouTube, it's the same way that I teach in the classroom. You see how messy my desk is? My boss comes in all the time. Ms. Lambert, clean up. That's what he tell me, clean up. It's inevitable for me to keep my desk clean. If I was in the front of the classroom and the podium, it would be the same way. And my students are out there, y'all are on a desk. Okay. The only difference is I would be walking around the class at some point, and then I would be up at my board. And my son came to my school one day, and he drew a picture of illustration of the human body, and you can see all of the veins, all of the arteries. And my students couldn't believe it when they came in the next day. They were like, "Who did that, Miss Lambert?" My son had came in from New York, and he drew that on the board. I know I got pictures of it. I know I have pictures. But again, it would be the same way. Now, at some point, the goal is to get the Zoom going in the YouTube. Okay, we're going to get the Zoom going in the YTU. The good thing about the YTU that I have seen is that every single thing that I said that I was going to accomplish has been done. Every single thing from the day one. If you look at the first video that I have done everything that I said I was going to do. I've purchased everything that I said that I needed to purchase. But there's always something else you need when you're doing YTU. And we're going to get there. We're going to get there. We're going to get there. So you got the medical terminology book that I just made. I will be going around to colleges and schools and marketing my book. And that's one of the goals. One of the goals is to make sure that these schools have my book. And the students can take this home, and I will be the one training these students to take their CPC. So you see, Ms. Lambert does not just teach on YTU, and I do still have a day job. You have to have goals to do what you want to do. Even if you have a baby, if you're at home, use that time wisely. Take that time and figure out what you're going to do. We're not going to be perfect. No, we can't be like Annie. No, we can't be like May. No, we can't be like Kim. Be like you. And you don't have to presume that you are somebody that you are not, because that is not how you're going to get by. Most people who know me, even all of these new people that I have met in Georgia, they know me. And the thing that I like about people who knew me in the past, there's nothing to sugarcoat about me. If you fabricate something about me, then it's just to make you look good. And I don't want you guys to think that. When you do something, you don't have to be like John, Jane, and Joan. Be like you. I want you to do what you need to do. I want you to be prosperous. Hi, Sean. I want you to do your work. I want you to set goals. If you have a goal, when you go back to school, right, Sean? You're going to be 100% at what you're going to do no matter what school you go to. Okay? So that is my tip for you. When you have a goal, set your goal and what you want to do and do it. You don't have to be like Jane, John, and Joe. Like I said, I want you to be you and be yourself. Okay? So now, back to medical billing and coding. Medical terminology is something that you're going to need when you do your CPC. You will not be able to decipher those courses, okay? So we're going to move past chapter 9. Now we are going to move on to 10. And this is the nervous system section. This is the language of medicine as it relates to the nervous system. I'm going to pop this up here so that you can see this. What do we have on the stage? There you go. So this is what we have on the stage. That's your language of medicine book, right? And this is chapter 10, the nervous system. So yes, I'm expecting you to do your summary for the nervous system, okay? Do your summary and make sure that you understand what you're doing in your summary. So when you finish this chapter, you're going to do a summary explaining what you learned out of this chapter. So you have to be able to spit it out. Be able to spit it out. That way, when you get ready to do your test, when you do your CPC and you're doing that coding, you won't be struggling with what you're reading. Okay, so again, in chapter 10, we're going to have introduction, general structure of nervous system, neurons, nerves, cells, the brain, spinal cord. Okay, we're going to talk about those things, vocabulary and terminology. They also have a little pathology in here. So as you guys can see, this section is a lot bigger than the ones we just did. Abbreviations, clinical procedures, sciatica. How many people have sciatica when you're at work and you're just standing up all day? Or you standing up for 2 or 3 hours, you sit down for a few minutes, you gotta stand up again. Listen, that hurts, okay? So let me get back to this. Review sheet. Okay, so we're gonna have our review sheet. So again, we're in the nervous system. So let me go down, let me see what the introduction is. So again, the nervous system is one of the most complex of all human body systems. More than 100 billion nerves. Cells operate constantly all over the body to coordinate the activities we do consciously and voluntarily, as well as those that occur unconsciously or involuntarily. We speak, we move, we hear, we taste, see, and think. Our glands secrete hormones and we respond to danger, pain, temperature, and touch. All of these functions comprise only a small number of the many activities controlled by the nervous system. So I definitely wanted to read that to you because the nervous system plays such a large part in the body. And, some people don't actually realize that they have to take care of their system in order for those nerves to work properly. We don't want to have pain in our hand and we don't know what it is. No, we're not going to be a doctor. But we're doing this, you need to go to the doctor and see what's going on. Definitely with the nerves. This section, and I presume it is so large because there's so much stuff they're going to talk about. The central nervous system, the CLS, okay, and the peripheral nervous system, the PNS. Okay, these are two major divisions in the nervous system. Okay, two major nervous systems. Now listen, this looks like it's going to be in the test. When I see stuff and I think it's going to be in your CPC, the term would be name two major divisions in the nervous system. I just told you. What are they, y'all? CNS and PNS, central nervous system and peripheral nervous system. Okay? One is coming from the brain and one is coming from the spinal cord down your back. Okay, I'm gonna pop this up here so you guys can see this. This is a long chapter, but some of you might not have your book. I still want you to see it. So if you have something like this on your CPC, your answer is going to be this and it's going to be that. CNS and the PNS. Your central nervous system, right? And your peripheral nervous system. So, those are the things that I want y'all to make sure you pay attention to. If I show you something, especially if I point something out, then I'm telling you that's going to be on your test. Okay? Your plexus. A plexus is a large network of nerves in the peripheral nervous system. I wonder why they don't have an illustration yet, but yeah, they do. Here it is right here. Okay, I'm going to show y'all in a little bit. Okay, so let me put this up for y'all. So, your nervous system is crucial. It's crucial. I mean, you're walking, you're feeling, you feel nerves, and you start tingling and something's not right, okay? There are other plexuses in the body, networks of intersecting blood vessels, okay? Lymphatic plexus is an interconnecting network of lymph vessels. Good, 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 good. I just want to show y'all this right here. The spinal and cranial nerves has receptors, sensory nerves, motor nerves. Yeah, this doesn't look too freaky looking. I'm gonna put this up there. Okay, so we can put that up. There's a look too crazy. The last chapter we did, I couldn't put. Listen, the last chapter was so y'all. I couldn't put that up there, even though this is not for kids. I certain stuff that I'm not going to put up there for y'all to see. Okay, but this illustration, I do want you guys to see this illustration. Okay, because that's going to help you with your test. You need to start memorizing some of this stuff. Okay, your cervical plexus. Right there in the back of your neck. I'm gonna put it up because I'm getting ready to read it. So we're gonna put it up for like a second. All right. So branchial, okay, plexus, right here in the back of your neck. Okay, there you go. Cervical nerves. You see that? C1. Okay, that's your gist. Okay. Spinal cord. Okay. Lumbosacral. That's sacral is like right up on the butt. Like when you sit down, you feel that bone right there. Sciatic nerve, femoral nerve. This is an easy one to remember because that's right in the back of your leg. Okay, lumbar nerve, thoracic nerves. Okay, I kind of like my favorite subjects are the nervous system and cardio. We get ready to do cardio right behind this one. Okay, so this class is going to go over. I can tell you that right now. This is going to go over. Okay, so the brain and the spinal cord, spinal nerves and spinal plexus. That's the figure that I just showed you. The femoral nerve is a lumbar nerve leading to and from the thigh. Did you guys see that? Leading to and from the thigh. I'm going to drop that up there so you guys can take a look at that. But make sure you get your book, okay? So my books are all the teacher's version. They might be a little bit different than yours, but I'm still expecting you to still follow me, okay? Even when you're on your own, I'm on page 323 and just pretty much going over some of the nerves, okay? I like this one right here. Can you guys see this? Let me put this one up. I have every rights to this book, so don't worry. There you go. So if you guys have your books, just take a look at this, okay? Because I'm getting ready to just kind of go over some of the nerves that are there, okay? In addition to the spinal and cranial nerves, whose functions are mainly voluntary and involved with sensations of smell, taste, sight, hearing, and muscle movement. The peripheral nervous system also contains a large group of nerves. Now, if I was in a classroom, I would have Tanisha read this, okay? But since we are on YTU, we have not gotten up to this point yet. But eventually, that is where we're headed. YTU, you will start reading. We will be a class in here. So the goal is to have you guys on the Zoom, on the YTU, and some of you are in the classroom, okay? Now, if you guys are in the Sapphire Coding Portal, we are on Zoom. That's the way I do it in my class. But YTU, we're going to do it a little different. We're going to try to do that here, but that's down the line. We're going to try to get that going. Okay, so again, I'm going to shoot this up here for you guys. I do want you to get your book, okay? So, where did I leave off at? Okay, the peripheral nervous system also contains a large group of nerves that function involuntarily or automatically without conscious control. Okay, the peripheral nerves belong to the autonomic nervous system. Okay, this system of nerve fibers carry impulse to glands, heart, vessels, and voluntary muscles found in walls and tubes. such as the intestine, and hollow organs, such as the stomach and urinary bladder. That's just a picture that I just showed you, okay? That's the picture that I just showed you. And look at this. I didn't even show you the whole thing. This is the brain, okay? The central nervous system. This is the brain. This is the picture. And this is telling you what it operates, okay? Your brain tells all this stuff to function, okay? Now, I know you guys know most of this, but again, this is a class for people who do not know and who is first learning medical terminology. Okay, cranial nerves, we're talking about sensories, efferent nerves. Do this chapter diligently. You need 3 hours to get through this session. You need 3 hours to get to this session. Okay. Sympathetic, parasmatic, pupils dilated, pupils constricted. When we get to that section, some of that's going to be on your test, which you guys already know. You go to aapc.com, scroll around in there so y'all can see what's going to be on your test. All right, I don't think I can show this picture, so I can't show this one. But this is just showing, body parts, secretion, adrenals, hormones, your digestive system. It's also showing your bladder muscles and how the bladder relaxes. It's just an invasive picture. I can't really put the picture on there, but I don't know who that is. But it's just kind of letting you know. So I'm just going to pull up a little bit past that, and then I'm going to show you where I'm at right now. So those of you who have your book, this is where I'm at. Okay, and I'm just kind of showing you the difference. This picture was a little bit invasive, so I didn't put the picture up there, but I still want you to take a look at that. Again, this is just your lecture that we're just going over what you're supposed to be doing. So once this class is finished, it's time for you to practice. You should be still reading some of this section and then still going over some of your work, okay? And your exercises, okay? And again, if some of you just started and you're doing your medical terminology, you can do both, not a problem, okay? Well, I don't think it's a problem, but you figure out what your schedule is going to be like, okay? Figure out what your schedule is going to be like, okay? And when you come on my channel, look at the front on the bottom. I have Sapphire ED CLS, and that's a class number. So if you miss a class, you could always go back and catch it. If I think of anything else to make sure you stay on track, I will add it and I will let you know. Okay. But again, this is the central nervous system. This is being archived, but when you guys archive this, send me a message and let me know what part of the central nervous system controls your arms. Okay. What part of the central nervous system controls your arm? What part of the peripheral nervous system controls your back, your arms, your legs? Tell me what controls what. Here's the answers right here. You want to look at this illustration? Look at that illustration. And then you're going to look at this one and get those answers. Okay? This is the one with the brain, and the brain tells you what to do. So I'm just kind of guiding you how you're going to do your homework, okay? So your homework is going to consist of what we're doing right now. It's pretty much your exercises. But you're going to have to find your answers. You're going to have to find your answers in there on that. When you are looking at a book as far as the reading material, I always tell my students to have the book here. Have the exercise here and have some kind of paper here so you can write down notes in case you want to ask me something for the next day. So when they're home doing their homework, first do they get in Miss Lambert? Of course, they done already wrote down what they have to ask me, but being that this is still Q&A, you guys can still ask me whatever. Okay, so again, you can go to Elsevier and go ahead and get those books, okay? So I just kind of backtrack because I wanted to show you where you're going to get those answers from. And again, there's so many different terms here. Astrocytes are star-like in appearance. Okay, and it shows you how to write it in the prefix and the suffix. Astro/0 means star. Okay, and transport water and salt between capillaries and neurons. Okay, those capillaries are like that water, like things like cushy in your body. Let's see. I don't think I can show you that. All right, so some of this stuff, no, I can't show you, but it's a little bit invasive. But I'm expecting y'all to look at this when you go home. Okay, I mean, when you go home, I think I'm in a class when this class is over. Okay, so we are now on the brain. We are now on the brain. Okay, so this is what we are discussing now. And again, that's a part of your homework. Okay, the brain controls body activities. Okay, in the human adult, it weighs about how many pounds, y'all? Let me show you. 3 pounds. Your brain weighs 3 pounds. Okay. What if that's on your chest? Okay. It says about, so it might be, you know what I'm saying? Okay. It has many different parts, all which control different aspects of body functions. So when you go to elsevier.com and you get your book, you will be able to see all these illustrations and all these meanings here, which is very, very easy for you to learn. Okay, the largest part of the brain is the thinking area, or they call it the cerebrum. Okay, some people say cerebrum. Okay. On the surface of the cerebrum, nerve cells lie in sheets, which make up the cerebral cortex. Let me find a picture. You got everything on here? Everything is on here. And this is something that you're going to see in your CPT book. You see that illustration? CPT is going to ask you something about this, I'm pretty sure. An illustration like that is also in your CPT book. So if you guys don't, again, if you don't have your language or medicine book, you could always look in there, and that illustration is also in that book. I believe it should be in your CPT, HCPCS, they're all in there. Remember what I said, look at all of those illustrations in your book. In the brain, you have the parietal lobe, the frontal lobe, okay, the brachial area, temporal lobe, occipital lobe, okay? Make sure that you look at all of this. So your cerebrum is here. Okay, and you can see how large it is. I'm putting that up. You can see how large it is. This is the cerebrum right here. Right? Okay, because this something like this, like I said, it might be in your test. They want to know, what's the largest part of the brain? And again, this is in your book. So, this is why, when you get ready to study, just make sure you be curious about what you're studying, because if you can't retain it, you're not going to pass the CPC. Okay, just make sure that you study. I'm going to put it up there one more time because I want you guys to make sure that you're clear on this. It's also in your CPT book. The picture's not going to look like this in the CPT book, but they have one in there that's similar to this, okay? So, your cerebellum is a smaller part of the brain. All right, it's at the back of your neck. Okay, it's not the back of your neck, but it's above your neck. Okay, so CSF. You guys remember me talking about CSF? Look at, I don't know what's going on with the nails. Right, circulation of cerebral spinal fluid. Okay, study that. Okay, that's in the brain and around the spinal cord. Okay. CSF, that's what we call it, CSF, okay? It's formed between the membranes, okay, around the brain within the spinal cord. It's a cushion, it's like, like mushy water, okay? I don't know how much of that I can give you, but that's pretty much enough right there. I want you guys to go ahead and read that. I am on figure 10.9, I'm on page 329, okay? If you guys are on the same page as I am, I'm right by the cerebellum and mid of the brain. Okay. I can see why this is a very large chapter because they go over everything inside out. One thing I want you to make sure that you note is the cerebrum. Okay, that's the largest part of the brain. Okay, that's the top of your head. That's the largest part of your brain. Remember that. There might be something on your chest. Okay, the cerebellum, that's the smaller part. Okay, it's at the back of the head. Okay, your spinal cord. Okay, make sure that you understand the difference between the CNS and the PNS. Okay, respiratory center controls muscles of respiration and responds to chemicals or other stimuli. What's this right here? This is something you should know too. Make sure that you take note with all of the illustrations that are in there, especially in the nervous system chapter, because you're going to see a lot of surgeries in regards to this section. You see a lot of people. I saw something today where a guy, I think got hit by a car or something like that. He was fine, walking just fine. And all of a sudden, like 2 months later, his legs came out from under him. You know, his nerves. They said that the nerve. Let me get back. I'm gonna show you that picture. So he had a car accident. He got hit, but he was fine. It was like 2 or 3 months later. So he kind of fell, and the nerve shot up to the back of his neck. The injury that he had traveled to his neck somehow, and now he can't walk at all. So again, you know, that's part of your peripheral nerves. You know, something happened in that aspect. There was a young lady who I don't know, she was one of my billows or she the front desk or something. She was at a party. She was at a skate party or a bowling party or something. And she fell and hurt her ankle. And she broke her ankle and she had her cast on. But she had returned to work. And she wasn't supposed to. She had returned to work. I don't know where she was. I think she was in the front end or something like that. And what happened was it was the saddest thing in the world. And the crazy thing was me and her had friction probably weeks before that. Me and her had friction. Something she didn't do in the front desk or something. But we kind of mended it, you know, after the fact. But something happened to her, and she came back to work. She's fine. XYZ. I'm okay. So. And did he give you clearance that you can come to work? You're on your leg. XYZ. So her supervisor said, you know, yeah, she has it. She has everything. She died 3 days later because the nerve, I guess from the broken foot, somehow something got damaged and it traveled up to her brain and she died. Who felt worse than I did? And I told the supervisor, you know, this was before work that she didn't do or XYZ. It was something, I don't know, it was a lockbox or something, but I just totally felt, you know, bad. I wished I had spoke to her even before that. But again, you know, that's your nerves. I mean, you have to be precarious of that. I mean, she had a cast on. She should not have been to work. She shouldn't have been doing anything. They're working up there in that front end when you're taking the copay and everything. You still do have to walk around. And I think maybe her leg got swollen or something like that. But again, it has to do with the nerves. So, you know, just be careful. You know, be careful when we are talking about the nerves. Okay, so now we are getting into the meninges. The meninges are 3 layers of connective tissue membranes that surround the brain and spinal cord. Okay, surround the brain and the spinal cord. Okay. They don't have a good picture of that. So scalp, cranium. I'm looking for this. They got something to show y'all what that looked like. Well, you see, I don't know, some of y'all work in the OR. Anybody ever been in on a craniotomy? I know that was one of my rooms was craniology, where I had to bring the instruments and stuff in there, and it was just. Let me tell you, I thought cardiothoracic was bad. You know, they take the crane and they crack the chest open and they got to crank it and hold it open. And I mean, Dr. Graber was a master. He was the best surgeon in the whole OR. I mean, when I worked with him, it was like he just knew. And, bless his soul, he had a plane crash. They told me, Long Island Jewish, that's what they told me he had. And, he was a master at a cardiac director. But the craniotomy will go in there and the brain is just open. You got that tool, it's called a hole. What is it called? A hole or a foot or something like that. It's a thing, it's like a little hole, it's like a drill hole that's going to be in your chest. It's a drill hole, holds up in the brain. Okay, and it makes it like a little hole in the joint. It's called a drill hole. And you see that thing connected to the, that's one of the reasons why I moved to billing. It was just, I couldn't deal with none of that stuff, man. I'll tell you, Dr. Livingston used to, Lisa, you not get out. And I just want to cry. I come in there and I see the craniotomy, the man's brain all open. And then, Dr. Livingston would say, Lisa, you get out. That's how he told you, Lisa, get out. And because I just couldn't take it. I just wanted to bring the instruments in there and just get out. I can't. And working in the OR is tough. Praise to all those men and women that work in the OR, especially when a baby got to come in there. Oh my God. That's why I got the children's hospital next to Long Island Jewish. I couldn't. I can't see those babies in there like that. I mean, I just couldn't. The OR, you come in there. Like my sister, she can take that. She can take, stuff like that. As tough as I can't take stuff like that. I don't want to see it. I couldn't even go in the room with my grandson. He fell down an escalator and popped his mouth open. They had to stitch him right in the mouth. And on my way, they called me on my way there. I'm driving. I'm literally passing out, half and half. And I had to get my sister to go in there because I couldn't take it. I would fall out. I'm not good with stuff like that. So that's why I told you I don't work in a hospital or a room anymore. My niece was having her baby, and my sister, that's my sister's daughter, and I passed out in the room. All I could hear was Sharina, and then I passed out, and then everybody was like, "What happened?" I said, "I don't know what happened." So a lot of people can't do that, but I don't care. I want y'all to put yourself in this operating room when you are coding those cases, okay? Just visualize it, okay? Visualize it, okay? They threw me out the OR, but, let's see. I mean, I still came back. I ain't leave till probably like a year or two later. All right, so the meninges are 3 layers of connective tissue. Now, we just talked about that, okay? The outermost membrane of the meninges is the dura mater, okay? This is a thick membrane, tough membranes, okay? That contains channels. Now, listen, you guys are going to read this chapter, okay? I'm on page 332. You're going to talk about the subarachnoid. I can't say it. Subarachnoid, okay? The arachnoid. Subdural space, dura mater. Okay, when you look at it, you will be able to pronounce it a lot better than me. Okay, they give you a little exercise with that. And here, this is wonderful. Anatomic nervous system. They're giving you definitions right here. Look. Some of y'all have good memories where you don't have to do all of the writing. If you do, just read it. Just get it in your mind, get it in your brain. Okay. You don't have to write everything down word for word. Just read it and be through. And you'll still be able to retain it. Just keep some of your index cards with words on them, with the medical terminology, okay? Okay, so we got hematoma, epidural hematoma. I thought that was going to show me where the dura mater is. Oh, well, yeah, here it is. Okay, look, let me show you this real quick. So they might ask you where the dura mater is. I don't know if it'll get that invasive or not, but you see this little line right here? I know you can't really see it, but when you get your book, that's where the dura mater is, okay? That red stuff is a hematoma, okay? Hematoma and bang is swollen, is out of control, okay? It's red, it's blood, okay? Hematomas, a subdural hematoma results from the tearing of veins between the dura and the arachnoid membranes. Okay, an epidural hematoma occurs when the skull and the dura as the result of a ruptured meningeal artery. Okay, a ruptured artery. Okay, it's almost like an aneurysm. Okay, let's see what they have. So they have a lot of combination forms. They have a lot of suffixes, also prefixes. In this section, we're already an hour in. I'm not gonna keep you up too long. I just want to kind of let's get down to the bottom. So somebody had a spinal tap. You guys seen this before. Some of you have, children. You might have had this spinal tap or something like that, or you might have had, this shot in your back. I'm gonna show it real quick. Boop. I don't like to show naked bodies and stuff like that. It depends on how you show it. All right. Okay, so abnormal accumulation. No, we ain't showing that. Spina bifida. You guys ever heard of that? Spina bifida. Congenital defects in the lumbar spinal column caused by imperfect union of vertebral parts. Neural tube defect. Okay, I don't know. They didn't put a period there. They put it right there. Okay, I'm not going to read the whole thing. Okay, I want you guys to do this for homework. Definitely do the nervous system for your homework. I want you guys to go over the nervous system for your homework. Because so many people have back problems. Spina bifida. Oculata. I never heard of that one. Occulta. Spina bifida cystica with the meningosa. Now I heard of that one. All right. It looks like it just gets worse and worse. I've seen that before. I've seen this before. I can't show y'all this. I've seen this before on one of those surgical shows. It was a surgical show, and she had this big thing on her back. It wasn't really on her back, but it was like her tailbone. It was like high up like that. When you do your homework, you guys take a look at that. There's a picture in here on page 342. I can't show it. Okay, Alzheimer's disease. Wait a minute. See, I was going to let y'all do that, but since I'm already down here, degenerative movement and seizures disorder. Okay, brain disorder marked by gradual and progressive mental deterioration. Dementia. Okay, dementia. Now, let me finish reading. Personality changes and impairment of daily functioning. Now, if you're trying to explain to somebody who might have a family member that has dementia as it relates to Alzheimer's, that's different. That's different. No, he don't have that. She don't have that. And you just like, all right. Now, you're the medical person. Your degrees, master degrees, is strictly medical. And they're telling you no, they're different. They're different. You understand what I'm saying? They're telling you that they're different. And the only thing you can do, because you want them to keep that mindset of it's better or worse, it's the same. So you do just so this is what you do. Oh, all right. Oh, yeah. Oh. And you don't say nothing else. You don't say nothing else. You don't say nothing else because you don't want to change their mindset. It doesn't matter that they know or don't know that it is the same thing. Maybe they think one is worse than the other. It's the same, okay? All symptoms click and it becomes the same. But when you try to tell somebody that, maybe it sounds worse or maybe it doesn't. But don't be trying to convince them. Just say, all right, and you keep it moving, okay? But that's y'all's homework. I still want y'all to take a look at that. All right, take a look at that. No, I'm not going to read it. It's going to tell you characteristics of AD. Okay, it's just giving you AD, Alzheimer's disease. That's all it's telling you. Okay, all right. Mental deterioration is dementia. Mental deterioration is dementia, okay? Characteristics of Alzheimer's disease: confusion, memory failure, disorientation, restlessness, speech disturbance, anxiety, depression, and emotional disturbance can occur as well. The disease sometimes begins in the middle of life with side effects in memory and behavior, but can worsen at the age 70. Okay, now, of course, you're going to notice little things that a person does before the strong onset of this. You notice a few little things, you notice, oh, okay. Hmm, hmm, what? Yeah. No, because that's how you be. What? Yeah, I'm telling you, it's just, I'm not gonna go through the whole thing, but we've all been there and done that and seen people like that in XYZ. Okay, there's a sign that definitely, I can't show you this one because of real brain, but there's a sign, okay? And in your brain, they're just kind of breaking down where the memory is and where you get Alzheimer's. See, if this picture wasn't here, I could show you this, but they have this picture. I'm on page 342, and it shows you the part of the brain that develops the Alzheimer's. Okay, it shows you the part of the brain. It also shows you the part of the brain that has a language, the part of the brain that has silicus. Okay, don't ask me what that means. I'm not reading it. Y'all are gonna read it. Epilepsy, chronic brain disorder characterized by recurrent seizures. Now, the reason why we're talking about the brain is because we are in the central nervous system and we are talking about the functions of the brain because it is in the nervous system, because that is where everything begins. That's what's telling my hand to move. That's what's having your legs to move. Okay, we get to peripheral nerves, which we did. Your body, it's your body movements there. Okay, temporal lobe epilepsy. I'm not going to read the whole thing. You guys are going to do this, okay? Huntington's disease. So some of this is also in your is it ICD-10? It's in one of these books, okay? In one of these books, you still have this in there, okay? Palsy. Okay, I want y'all to make sure y'all take a look at that. I've seen this before. Matter of fact, somebody had said no. That was I think blepharospasm you had. This is Bell's palsy. Bell's palsy when your face droops. Okay. They might ask you that. Notice the paralysis on the left side of this man's face. The eyelid does not close properly. The forehead is not wrinkled and would be expected, as there is clear paralysis of the lower face, the palsy spontaneous. So I've seen this before. We've seen this before. Some of you who worked at a hospital before, you may have seen this before. I'm going to drop it up real quick. It's called palsy, and again, it has to do with your central nervous system. So again, that's a part of y'all's homework tonight. I'm just kind of going over what you're going to be doing. So we went over a lot of things that has to do with the nervous system. I have to do this one, multiple sclerosis. I want to do multiple sclerosis because one of a friend of mine had multiple sclerosis. I mean, I know a lot of people who've had these different diseases. I think the worst disease that I knew somebody who actually had was skin cancer. That's the worst, the worst. I felt so bad for her. She was an FBI agent, and the doctor misdiagnosed her. And the trauma of her having that just was all over her body. It was horrible. But multiple sclerosis is also central nervous system disease, destruction of the myelin sheath on neurons in the CNS, and its replacement by plaque of sclerotic hard tissue. So, I'm not going to read the whole thing. That's for your homework and that's for you to read. But again, I'm just kind of giving you a heads up of what the nervous system is about. You guys, some of you already know. Some of you are already in the medical field. You already know Parkinson's disease. All of these different things comes from your CNS. So there's different parts of your brain that controls this. Different parts that controls that. When you get your book, I want you to make sure you look at those illustrations that are in there. Okay. Figure 10 to 20. Take a look at figure 10 to 20. Meningitis. herpes zosters. Viral infection peripheral nerves, blisters and planes spread along the peripheral nerves and are caused by inflammation due to herpes virus, the same virus that causes chickenpox. Reaction of the chickenpox virus, herpes virus doctor. Now, some people have this, like the herpes doctor. It has nothing to do with herpes. It has to do with chickenpox. So if you've had chickenpox before, and sometimes the chickenpox don't go away at 100%, this is what happens to you. It becomes like a shingles type of thing. We did like a study on this, the zosters, and it's pretty much it's like chickenpox. That's what it is. It's like chickenpox. Like you might get it in different spots of your body or something like that. But again, it's what they call it now is pretty much a shingles type of thing. Okay. But now you have the shingles shot XYZ. So if some of you see something like that, that's all that is. Okay. Painful blisters followed by underlying route dermatome of cranial or spinal nerves. Okay. And it's mostly at the lower body that you would get that. Like, lower part of your stomach, like your back or something like that. Human and physiology. I ain't talking about that. Y'all go ahead and talk about that. When y'all do your homework, y'all go ahead and do that. I'm just kind of looking through, so I can show y'all this page just a little bit. Horrible. Let me find another one to show y'all. Brain tumors. I can't show you that. All right. So I'm not going to go through the whole chapter. You are going to do this chapter, migraines. Oh my God. I'll try to get past that when I spotted it. So, I used to have horrible migraines. I don't know about anybody else, but I was a little girl. I probably was like 10 and 11 years old when I used to get them. I got them all the way up until my son. How old was my son when I got the last one? I think my son was 6 years old when I got my last migraine, and I never got them again. Migraines for me started when I was about 10 years old. And why, I don't know. My mother would just, give me the Tylenol or XYZ. And, it's something that maybe have been in my family. I don't know, but I'm glad it is gone and I do not get them anymore. Like I said, the last one that I had was when my son was about 6 years old. And I never had them again. It was scary. When I realized that I wasn't getting any more migraines, it just dawned on me, I haven't had a migraine. And then I'll just thank God I didn't get them no more. Okay. And again, nervous system. That's what we're talking about right now. Okay. So like I said, I'm not going over, you're going over severe recurring unilateral vascular migraine is associated with the aura, peculiar sensations. They said peculiar, killer sensations. It even shows you a picture of where the migraines came from. It's real, so I can't show you that. It's a little bit disgusting. All right, we're not going to talk about aneurysm because I'm already pissed off about that. We're not talking about that. But you guys are going to talk about that. Oh, see, they talk about the site of the needle puncture on the spinal tap. Okay, the EEGs. This is an amazing chapter. The pictures are amazing. I know. I'm sitting here acting like I'm one of the students. Okay, so here I am. I passed all the other stuff, and now I'm down by the abbreviations. So you guys are going to do the abbreviations. I got to look at this chapter again. I haven't seen it in a while. Or something because this book is totally different from my other book. And it explains it a lot more easier and with a less little tiny word. You guys know my other medical terminology book I got. It's not quite like this one. I would have to definitely break it up, but this one is a lot better. But anyway, here, these are the terms that you're going to study. Okay, make sure you guys get them down on index cards. Okay, so I'm gonna cut this one down. We done with that. Okay, y'all can look at that. I'm not doing all that. Okay, so now we just go to cardiovascular, which cardiovascular will be quick, will not be as long as the nervous system. I'm just going to show you guys this real quick. This is cardiovascular. You guys should have your book. Okay, you should have your book. So I'm not going to do too much show on this one. I'll probably end up going over this one in the next chat. But here we're going to be talking about the blood vessels and the circulation of the blood. Okay, we're going to talk about the brains. We're going to talk about arterioles, arteries, and we're going to talk about, things that might be on the CPC. Okay, and yes, some of these things are going to be on the CPT, especially what are the blue ones, what are the red ones, right? But they may have multiple choice. You want to pick the blue, you want to pick red. That's the kind of stuff that we're going to talk about. So when you guys do go over this chapter and you see stuff like this, just make sure you take heed to stuff like that. Okay, because things like that is what's going to get you to pass your test. And like I said, if you have to read this thing 10 times, just keep reading it until it feels second nature to you. Okay, oxygen poor blood enters the right side of the heart. Now, remember, the heart is a function. It's a big function. So it's just like how you work in a car, how you get a car started. It's a function. This is first, that's second. This goes through that. Lungs, capillaries, pulmonary veins, oxygenated. What comes in, what comes out. That's the heart, baby. That's your whole function right there. This, I really want you to pay attention to. Between these 10 and 11, I cannot stress to you guys enough how much you need to pay attention to these two chapters. Okay? They are your hardest channels. Forget about lab and pad. Okay? Let's just pray you don't get it. Okay? Forget about radiology right now. Forget about anesthesia right now. Those three are the three funkier ones on your exam that you're going to have. Okay? But these, I want you to know explicit, because where you're going to be working, okay, where you're going to be working. Most of you will go to a doctor's office that is cardiology. Most of you will go to a doctor's office that is neurology or nervous system. That's why I want you to make sure that you are explicit on the nervous system and cardiology. I can't stress that enough. You must know these two sections. When you're studying this, I want you to have your CPT out. So again, the nervous system that we just went over, I know it was powerful. It was powerful. Cardiovascular is just as powerful as the nervous system. Okay? You talking about the right side of the heart. Remember the oxygen, right? The lungs, capillaries, the left side of the heart. Oxygen-rich blood, aorta, arteries, carotid, pulmonary, oxygenated, non-oxygenated. The venae cavity, veins, venos. That is going to be on your exam. That's going to be on your exam. I know it sounds scary as heck, but I'm telling you right now, that's the kind of stuff that's going to be on your exam. Between these two chapters that you and I just went over, you must get these two down. It's not only for the CPC. It's also in case you go into that doctor's office, okay? Most doctor's offices, when you see them, they're primary care. But when you go to surgical centers or you go to surgery offices, they're orthopedic, they're cardiovascular, or, their nervous system, neurology. Just be precarious of, these two chapters, okay? All right, let me come back down. Okay, so just to kind of give you, that heads up, renal arteries, abdominal aorta, axillary arteries. You must pay attention to those things. The carotid artery. She might say, the CPC might say, where is that? Where is it? They might say, where is it? In the illustration on page 377, that's where you're gonna find it at. Okay, so don't forget, when you guys get your book, Pay attention to those illustrations because on your CPC, they may ask you what some of these things are. And if the only way you can remember them is to put them on your index card, put them on your index card. Okay. Oh, this is my favorite. Anatomy of the heart. Now, remember I was telling y'all sometimes they want you to identify, the anatomy of the heart or what's in the heart. Who told me that they had? Well, that was there like years ago. It probably had the same question. The order, of the heart, the order of what's on the right side, what's on the left side. The human heart weighs less than a pound. Now, how much did the brain weigh? About 3 pounds, right? The brain weighs about 3 pounds. So the human heart weighs less than a pound, between 300 and 450 grams. Now, on your CPC, they may not ask pounds. They may say, how many grams does the heart weigh? They may not say pounds. The brain, remember we just did the brain, 3 pounds. They may say how many grams. So as we are looking for this, I don't know what page, I'm on page 377. Make sure that you guys take heed to this. This will be on your exam. It will be on your exam. Okay? The heart is a pumping consisting of 4 chambers. Oh my God. Test. And you know what I'm going to do? We're going over this again. We are going over 10 and 11 again. We're going over this again on Monday because we can't stress this enough. Okay? I'm trying to figure out how I can give you more of this. So let's hit it. Let's hit the chambers. That's on your test. I'm telling you right now. Pay attention to these few words that I'm going to tell you right now. I want y'all to put this on index cards. The heart is a pump consisting of 4 chambers. 2 upper chambers called atria, singular atrium, and 2 lower chambers called ventricles. It is actually a double pump, bound into one organ and synchronized very carefully. Blood passes through each pump in a defined pattern. Now, this is what I want you to do, because this is what I did. Go on your search engine or YouTube, find in YouTube to find you a circulating heart. YouTube, show me a heart. YouTube, show me a circulating heart. YouTube, show me how the heart works. YouTube, show me the parts of a heart. YouTube, show me arteries in the heart. YouTube, show me veins in the heart. Okay? When you visualize, See, if I'm just showing you like this and how we just read it, you can't visualize it. When you visualize it and you see the heart pumping and you see what's going in and you see what's going out, you see where the atriums is, when you take that CPT, you're going to ace it. Okay? You're going to ace it. Okay? Pump station number 1 on the right side of the heart. Okay? Let me tell you something. You have to I can't give you everything, and I ain't read the whole thing, but you have to learn it. Okay? You have to learn it. Okay? And I just want to give you a little aspects of how that heart works, because where are we? We're talking about cardiovascular, right? You remember when I was telling you about cardiothoracic surgery? This is it. This is you getting to know what it's like. And I can only visualize it because I've been in on cardiothoracic surgery. So I've seen the heart literally pumping. This is the craniotomy. The chest is literally open. It is held by a crane open. And Dr. Graver I don't know how he did it. He was a fantastic surgeon. And I come in there and I'm bringing instruments and I see that heart. And Dr. Graver, I don't know. I have no idea why water is all over the floor. I don't know, but whatever they do with the heart, and then Dr. Grady's all his heart machines and everything in there, and your room is just full. And I'm like, I'm trying to give him the instruments, and it's like, I'm just ready to get out of here. But again, The body is the most interesting thing that you will ever learn in your life. Medical terminology, and you see, like the beginning of the medical terminology, y'all are like, I don't want to watch this. I don't want to. I bet y'all want to watch it now. Y'all want to read it now, and hopefully y'all are sticking with me through this whole thing, because heart and the nervous system is the hardest chapters you're going to get through. When you start talking about those chambers, you remember when we were talking about the 4 chambers? That's on your test, okay? So let's keep it moving. So we're just I'm trying to finish at 1:30, but I don't know, this might be a 12 class, okay? So again, we're talking about oxygen, poor oxygen. Oxygen poor. Blood enters the heart through the 2 largest veins in the body. The vena cava, okay? The superior vena cava. Let me tell you something. If you had a question on your CPC, what would you tell me? If I say name the 2 largest veins in the body, the vena cava, the superior cava, which drains your blood from the upper portion of the body, and the inferior vena cava, carries blood from the lower body system. You can't get better than that. As you read, here's a picture right here. Well, it's not the picture that I really wanted to show you, but it gives you a little idea. Check YouTube. Ask YouTube for what you want. Okay, ask YouTube for what you want. This picture, I want y'all to use this picture as a test picture. Okay, I got 4 minutes. I'm not going to go past 1:30. But you can use that picture, okay? So now we're getting into the questions, and this is one of the questions. Structure of the heart. I told y'all, structure of the heart. Now, let me show you. The difference between the CPC question is the CPC is going to have multiple choice questions, and it's going to say, name the 4 chambers of the heart. Multiple choice. Okay? And they ain't going to be just that easy. They might say, put it in order. Name the right order. Okay? So that's why I want you to make sure you study medical terminology to the fullest. Okay? Where's my book at? Okay, there we go. Oh, this is it. This is what I want. This is exactly what I want y'all to see. I hope y'all still here. And y'all, those of y'all who are archiving this, make sure y'all stay to the end. Right chamber. Left chamber. Right up, right down. This is going to be on your test. I'll tell you right now. Make sure y'all get this. Okay? Make sure y'all get this. All right, so we can't go through the whole thing, but I'm trying to find a picture that y'all can see. They talking about the blood pressure, electrocardiogram. Ooh. STEMI. Where's the other one at? Look, I'm on page 383. Make sure y'all study the STEMI, all right? This is it right here. Make sure y'all study this. This is something like this is going to be in your test. They're going to ask you what the STEMI is, okay? I know it sounds like a lot that you guys are going to be doing, but in order for you to pass that CPC, you must know medical terminology, okay? And pay attention to what you're doing. Just write it down, okay? T-wave, the ST segment, okay? We're going back over this tomorrow. What time is it? I'm already time over. I only have like 2 minutes. So I'm not going to finish this chapter. We're going to finish this tomorrow. Y'all got class tomorrow, so we're going to finish this tomorrow, right? Because I definitely want y'all to see endocardium, lining of the heart, mitral valve. But so I'm gonna cut this down. We're gonna let me see what page I'm on. All right, I'm on 384. Okay, so I'm gonna get back at this one, 384. Okay, so we're gonna end this chat. As you can see, medical terminology and cardiovascular is major. Okay, and I want you guys to make sure that you steadfast on both of them. Okay, I don't care if you have to stay on it for 3 hours, read it. So you got 2 chapters to read tonight. 9 you were supposed to do last night. tonight, nervous system, cardiology. All right. Those of you who are new to this class, make sure you stay to the end. Thank you so much. Subscribe to my channel. Make sure you look for us again. Make sure you go to my website and get my book. Check out all those links below. Okay. Do not forget, when you are studying, have your ICD-10, your CPT, whatever coding books you have, just so you can see what we're talking about in the language of medicine. Okay. So, adios, amigos. I will see you guys tomorrow. We are still going to finish this chapter. We are in cardio. Okay. We just did nervous system. Recap. Okay. I got to finish this chapter. Remember how important the nervous system is, how important the cardio is. Okay. So just do an archive and you guys can see the rest of this. Thank you so much. Tell your friends, subscribe to the channel. This is a real class. I am a real professor. Make sure you get on it. You guys give me a thumbs up and we can continue on. Okay, we're going to make sure y'all pass that CPC. Bye-bye.